Hi, my name is Daisuke Shibata. I'm Associate Professor at Athletic Training Program. I want to talk about the facilities that we have. So we have two main classrooms that are designated for our program. So one classroom right here, we have the two different sections. Front side, we have the traditional work classrooms, which has the chairs, tables, projector, screens. And the other side of the classroom here, we have more similar to a traditional clinic, which allow us to practice the therapeutic exercises, modalities, physical examinations. Other classroom, we have the similar setting, but we have also the chairs, tables, projectors, screens, as well as we have the treatment table, which allow us to do the physical examinations in the room. Also, we have the two additional relatively smaller room, which we can use for physical examinations as well as a simulation. The simulation allows students to do the physical examination on mock patient, which also can be used for students to do some private practice, including a job interview.
One of the highlights of UNM's athletic training program is our faculty's professional expertise and involvement. Our faculty have a lot of different experiences and expertise that we help transfer to students, including different research areas in concussion, posture, motor control, interprofessional education, documentation, and education and athletic training. This allows us to provide a comprehensive and in-depth preparation for athletic training students. So you get involved with a profession, and then you also get a really well-rounded education, so you make sure that you are prepared to work into any athletic training setting that you want to go into.
One of the really unique things about our program is that we offer a certificate of honors in interprofessional education. So what is interprofessional education? Well, this is where different healthcare providers work with each other to learn from each other, to understand how they provide care in order to increase and optimize the care provided to patients that we work with. So for athletic trainers, we commonly work with physicians, nurses, nurse practitioners, physician assistants, and other healthcare providers to do just that. So part of the curriculum here at UNM is to have athletic training students engage with different healthcare providers through different mechanisms, such as working through Project Echo clinics, like the primary care Echo clinic, or working at urgent cares where patients are being treated by not only the athletic trainers, but with the physicians and the nurse practitioners as well. There's also workshops and conferences and other types of activities that we have athletic training students engage in. So you're getting a really holistic review of how to work with different providers in a very modern healthcare system.
My name is Alyssa Momini, and I'm an assistant professor in the athletic training program. One of the key characteristics of the Master of Science in Athletic Training program at the University of New Mexico is that we have small student to faculty ratios. So this really offers the opportunity to work with a diverse group of learners and understand the way that they can be successful in the classroom and make sure that we implement them to ensure their success through the program and as they prepare for the Board of Certification exam. One of the things that I really love about the Master of Science in Athletic Training program here at the University of New Mexico is the opportunity to really work with students during that first semester where we begin just introducing anatomy and just very minimal biomechanical deficits that we can identify within our patient populations, and then progressing students throughout the next few semesters in terms of clinical eval of the upper and lower extremity. We also make sure to train our students to be able to evaluate conditions that occur at the trunk, torso, head, and neck. And then for the final semester that they have with clinical eval, they actually learn how to evaluate the whole patient from a holistic point of view. So how can we look at videos of our patient populations and then identify deficits that we can inquire about when we create our rehabilitation programs.